Well, as I say, I'm an endocrinologist, and when I started my career as a registrar, I started working at our lipid clinic, and I saw a little patient with homozygous familial hypercholesterolemia. He was 10 years old at the time and had a cholesterol of over 20 millimoles per litre. At that stage, we had the only treatment available to us were old drugs like cholestyramine. Statins hadn't even been started. And unfortunately, he died at the age of 10 and a half. But it's been remarkable to see how treatment have advanced from statins to ezetimibe, now to the PCSK9 inhibitors, and newer drugs like the ANGPTL3 inhibitors. So we've managed to convert particularly the severe forms of heterozygous from a lethal disease in childhood to now much more treatable dyslipidemia. So many of my patients, it's been a pleasure to see them living longer and not having coronary events and leading normal lives. So I think what's really exciting is the newer therapies, there's potentially gene therapy, but the advantage of these therapies is much less frequent dosing. So, often monthly or even longer. And in the future, maybe gene therapy to correct the genetic abnormality, maybe in the future for these patients. So one of the biggest problems is, the prevalence of familial hypercholesterolemia is about 1 in every 300 people So there's over 30 million people in the world. It's an asymptomatic condition. You don't know that you've got it. So one of the, particularly for practitioners out there, if they see anybody with early onset heart disease, they have to think about familial hypercholesterolemia. And anyone with a high cholesterol, they need to test family members, because if you have an index case, half your children would have got the condition from you and half your siblings would be affected. So familial hypercholesterolemia at the moment is grossly underdiagnosed worldwide. Most people are unaware that they've got the condition.